finding stuff out about my placement. Recently I've been really slack and not been recording much about my placement, and there's kind of two reasons for that. One, I've been lazy, and two, we've got so much going on at uni at the moment around kind of placement and things we have to like tick off basically. So this is going to be telling you about 2 days of placement in one really, because I had to do 2 half days, so placement day 3 and 4 I guess. So here we go. So for uni we have to do a video. We're in little tutorial groups that meet up once a week, and one of those tutorial sessions is showing a video of us with a client, and then we get feedback from our peers and a tutor about what went well, what we could have done better, and what we'd probably do a bit better next time. So that's really helpful and useful for just rapport with the clients, anything we could have done in our session a bit differently, so anything we could have planned differently that maybe would have made the session run a bit smoother. I had to do my video a couple of weeks ago now. I did it with a man who was having a pre-treatment for radiotherapy. So I think I've discussed this before maybe, but basically he comes in and we tell him about how speech and language therapy fits into radiotherapy, so the effects that it might have on his voice, on his swallowing and on his ability to speak. He was great, he didn't mind being filmed at all. So the main bit that I went through with him was explaining exercises to do during radiotherapy and continuing after radiotherapy. And I've talked about this before in one of my videos about the reasons we do this, so to keep the muscles supple because of the reduced blood flow to the area because of radiotherapy. I'm going to make a video about those exercises, so I think there's about 5 or 6 exercises, and I think it'd be really interesting for, or really useful for people to know about if they're undergoing radiotherapy and they haven't, for example, seen a speech therapist for whatever reason. They can go to that video and check them out. So once I've done it, I'll put a link in the description and you can go and check out the exercises that I did with that gentleman. Obviously, for confidentiality reasons, I can't show you that video, but what basically happened is I explain what exercises there are, the reasons for doing them, and I demonstrate them to him and get him to do them with me. So I know he'll be able to go home and do them by himself. The second thing I've had to do recently, we have something called a tutor visit that everyone at uni gets a bit flustered about. So it means that a lecturer from our uni comes in to see us on placement. So a bit nerve-wracking, and they kind of come in, look at how you're doing, and also have a discussion with you and your practice educator, your PE, and kind of discuss your aims, what you think you're getting out of placement now, and maybe how that can change for the better in the future. So I had to come up with some aims for my placement, which I can share with you. And then my PE kind of agreed those aims, and there's a form you have to fill in at the beginning and the end of your placement to see how you've progressed. So I made a little sheet. I'll tell you my aims. Okay, so my first one is to develop skills in the assessment of dysphagia. It's basically the term for swallowing difficulties. A swallow assessment includes going up to a ward, collecting all the information about a patient, so looking at their case notes, making sure that you've got all of the information before you go and see them. So for example, if they've got a temperature, or if they've been aspirating a lot recently, so if they've got a chest infection, that should ring alarm bells. If you've completed that, you will go and see the patient. So that involves speaking to them, finding out what their difficulties are, kind of assessing them. So are they orientated? Can they tell you the time, their name, things like that. You will assess their communication, so just getting them to speak. So asking them about their day, what they've been up to, so how they've been getting on recently in hospital. and from that you can gauge their expression, their comprehension, and if there's any difficulties there. And then from that you will decide whether you can do a swallow assessment or not. If somebody is struggling with tongue movements and the range of motion in their tongue, you might start off with yoghurt, because when they have the yoghurt and try and swallow it, you'll be able to see any residue in the oral space. So any yoghurt left around their tongue or underneath their tongue, and you'll be able to see where it's pooling. So that's really a good way to find out that. If they've been coughing on liquids, you may try them on a little bit of just normal water. It all depends on the client really and what you found out from their case history, and kind of play it by ear. So you see how they react, see if they can swallow, whether there's any delay, whether there's any residue or signs of aspiration, so coughing, or a wet voice, so cervical auscultation is used. So that's using I can't remember what they're called, the things that you hear through like doctors have. They use them to listen to whether somebody has a wet voice or not, and that's a sign of aspiration, so we don't want a wet voice at all. When we go and see people on the ward, my PE is usually doing the swallow assessments because it is quite risky. So if they've just had surgery on their tongue or neck or voice box, then obviously things are going to be really sore. They're going to have stitches, which if we push them too hard with exercises might rupture. The kind of knowledge base you need for head and neck, I felt more comfortable with my PE doing all of the swallow assessment. But now we've kind of thought about it, and she said that it would be a really good idea for me to try and do a swallow assessment via kind of proxy. So she is going to do all of the actual practical stuff and I'll tell her what to do. My second aim is to collaborate with MDT, like my co-workers basically, so nurses, psychologists, other SLTs all around the hospital. So I've put the ways that I'm going to do this are to discuss a patient with a nurse, so have a patient in mind, go and talk to the nurse about how they've been doing that day, and also then feedbacking after my swallow assessment, going to talk to that same nurse and saying this is what we found, these are what my recommendations are for this patient. Aim number 3 is continue linking theory to practice. So recently we've had so much teaching at uni and I feel like I need to really link what I've been learning at uni to what I'm doing on placement. So making sure that in my notes I'm using all of the right terminology, all of the things that I'm saying to patients I want to be correct, and obviously that takes a bit of practice. My PE has agreed that when she has a patient, she's going to give me a little case history. I'm going to write an aim for that person, what I'd expect to see. So when we go up to the ward, what I'd expect to see from them. So if they've had a glossectomy, obviously they're going to have the structural differences, so no tongue there, and most probably the flap. What my hypotheses might be, so if they've had a glossectomy, my hypotheses might be that their speech intelligibility is probably going to be reduced, their swallowing is probably going to be reduced as well, and then about their prognosis, so how I think they might get on after treatment. So all of that together is going to help me really link what I've been learning at uni to a patient that I'm seeing. So when my tutor came in, that's basically what we talked about. I came up with those aims and we discussed how we're going to achieve those aims by the end of placement, which now is only about a month away, so that seems really strange. I'll keep you updated with what I'm doing on placement as I go along, but for now, if you liked it, give it a like down in the like bit down there, and subscribe if you want to keep hearing about what I'm doing on placement. Alright, I'll see you soon. Bye.